Hello and welcome to another webinar presented by Axxess. I am Penn Hoyt, Director of Marketing for Axxess, and we are very happy to have you as part of this event. At Axxess, we believe that teaching what we learn helps everyone to grow. You can count on Axxess to continuously create and present content to help your staff and your agency thrive in today's quickly changing environment. Before we begin, I'd like to share a little background about Axxess. Axxess is a technology company that provides software for health organizations to efficiently run their business. We empower healthcare companies with an easy-to-use, cloud-based software that integrates all aspects of their operations so that they improve patient outcomes while growing their business. We are the fastest-growing home health technology company in the country today, and also the #1 recommended home healthcare software by users just like you on Software Advice. Over 90,000 users log on to Axxess daily, representing over 1,800 agencies serving over 500,000 patients across the country today. Axxess has achieved many firsts in the industry. We are the first and only home healthcare technology company approved to award CEUs by the American Nurses Credentialing Center. We are the first and only company to have a native mobile app that works on both Apple and Android devices. And Axxess is the first software company approved to conduct CAHPS patient experience surveys. Now, as promised, let's start today's webinar so we can give you the knowledge to help grow your business.
Thank you for joining us for the Home Health 5-Star Rating System, How Do You Rate webinar. Today's webinar will provide a general overview to the new star rating system and the Axxess Advantage. This webinar will be of particular assistance to administrators, Director of Nursing, Director of Quality Improvement, or others in similar roles, or anyone generally interested in the new CMS Home Health 5-Star Rating System. Today you'll basically learn about the background of the star rating system, the components of the star rating system, and how the star rating system integrates with Home Health Compare and utilizing the star rating system for long-term success. Now, most of us are consumers, if not all of us, and we're used to either shopping online or in the good old-fashioned brick-and-mortar building. In our quest for quality products, we're very interested in knowing how products are rated. Typically, most products or services are rated on a 5-star rating system. So CMS is essentially doing the same thing. CMS has adopted the 5-star rating system as a means of communicating to consumers and other stakeholders the level of quality being provided by healthcare organizations that are certified by CMS. The 5-star rating system can already be seen in dialysis, nursing homes, and in the hospital setting. In January of this year, the Health and Human Service Secretary, Sylvia Burwell, made an announcement that did not come as a major surprise to industry watchers, and that was that CMS was moving in the direction of reimbursing for the quality of care versus the quantity of care, tying reimbursement to the quality of care through alternative payment models. So why was this statement about the shift in payments significant? Well, if we go back and look at the work done by the Congressional Budget Office, looking at 50 years worth of data on the 4 major programs that take up the majority of the federal budget, and which we can see here, Defense, Social Security, Medicare, and Medicaid, we can see that whereas defense declined from about 50% of the federal budget to 19% of the federal budget in ending 2012, we see that Medicare and Medicaid went up from about 0% in 1962 to about 16 and 7% respectively. And current projections are that if we do not do anything, Medicare alone will be at about 20% of the federal budget. Essentially, we're spending a lot on healthcare. Another way of looking at this is looking at health spending by industrialized countries around the world. The Organization for Economic Cooperation and Development, or OECD, released this data in 2013. And we see essentially that the United States far outspends other industrialized countries in healthcare. And essentially what we're trying to say is the cost of healthcare is unsustainable. So what is CMS doing about this? Essentially what CMS is doing is they've divided reimbursement into 4 categories. Category 1 is where we're currently at, fee-for-service with no link whatsoever to quality. A claim is submitted and paid without really looking at the quality or the efficiency of care being provided by the healthcare organization. The goal is for us to move to Category 4, which is population-based payments, where payment is simply not derived from the amount of services that are provided, but that clinicians, organizations are paid based on the care that's provided to a large population of patients over a longer period of time. So essentially, an investment in keeping members healthy overall. So we see that Pioneer Accountable Care Organization are an example of where CMS has started piloting, providing demo projects around providing reimbursement based on managing a population of patients. CMS understands that this shift needs to be gradual, and so Category 2 is where we move from fee-for-service but link it to quality. So a portion of the payment is based on the quality or the efficiency of care that's being provided. Category 3, which brings us even further along, still using a fee-for-service architecture where payment is linked to management of a population or episodes of care, but we're beginning to look at care across a continuum of care, and that's what we see with accountable care organization, medical homes, things such as bundle payments as well. So if you derive nothing else from this slide, essentially we're currently in Category 1, and CMS is trying to move us over to Category 4 with population-based payments. Part of what we also saw in the announcement was targets. The target is that by 2018, 50% of alternative payments will be in the categories 3 and 4, where we're eventually moving towards population-based reimbursement. And 90% of the current fee-for-service will be in categories 2 through 4, meaning that where we're at now, by 2018, when we're at about 20%, that by 2018, 90% will be of fee-for-service will be linked to quality and outcomes to a certain extent. What we see is that by next year, we'll be moving to 85% of fee-for-service linked to quality. So next year is sort of that step in between really getting to the majority of the system being on anywhere from categories 2 through 4 and really moving away from Category 1.
If we're just trying to get a general idea of really where we're trying to go and how we're going and what we're going to need to do to bend that cost curve, looking at the Institute for Healthcare Improvement, the triple aim model is a great place to start. The triple aim essentially says, look, ultimately we're going for a better care experience as individuals and a population where we're receiving safe and effective, patient-centered, timely, efficient, and equitable care, and having that delivered at a reduced cost, or at least in an affordable manner, by all the stakeholders involved, whether they be individuals or families, employers, or the government. Another item that we need to look at as the basis for the star rating system is the passage of the Affordable Care Act in 2009 by Congress. It required the Secretary for Health and Human Services to do a number of things, including coming up with methods for the public disclosure of information on how home health agencies are performing. To that end, CMS determined that they wanted to come up with a system that kept the current payment policies using 60-day prospective payment episodes, utilize the existing measures of the OASIS assessment and the HH-CAHPS for reporting quality, and using the vehicle of Home Health Compare to communicate to key stakeholders the performance of home health agencies. So in regards to the star rating, the star ratings were CMS's response to the mandate by Congress, or at least one of the responses, for presenting the information in a manner that stakeholders can better understand it. And so public reporting is essentially a key driver for the ultimate improvement of healthcare quality, because consumers can make choices and healthcare organizations are incentivized to make the necessary changes to their infrastructure and the delivery of care to ensure that it's efficient and that quality care is being delivered. CMS is adopting the star rating systems across all the Medicare.gov Compare websites, and it already exists for nursing home, dialysis, physician compare, hospital compare, and home health compare have already started the process of implementing this in 2015. So when we talk about star ratings, at least for home health, there are two main categories. The first category is patient care star rating, which is starting July 2015. This stars, or the star rating, is based on OASIS assessment data and claims data. The second category of star ratings are based on home health CAHPS data and are referred to as patient survey star ratings, which are slated to start January 2016. And by starting, we're referring to the fact that they will be publicly available for home health agencies on the Home Health Compare website for those dates. January 2016 for the patient survey star rating, and July 2015 for the patient care star rating system. So let's take a quick look at the criteria for the patient care star measures. Essentially, the measures selected needed to apply to a substantial portion of home health patients and the agencies caring for them. There needed to be a reasonable amount of variation between home health agencies when reviewing that data in order to be able to show improvement in performance over time. High face validity and clinical relevance simply refers to the fact that the quality that we're attempting to measure, that the measure selected did that, and that it needed to be stable without a substantial amount of variation in between measurements. And so there wouldn't be wide variability as we measured quality using that particular measure over time. There are 9 patient care measures that are at least initially selected for star ratings. These were refined over time, starting from late in 2014 into 2015, and there's a possibility that over time CMS will revise these further. But at this point in time, these 9 measures fall into either process measures or outcome measures. Both of them should look fairly familiar from the use of the outcome-based quality improvement and CASPR reports, or reports that are available in CASPR. And so timely initiation of care, drug education, the administration of the flu vaccine are some of the process measures versus the outcome measures, which are improvements in ambulation, bed transferring, bathing, pain interfering with activity, and an improvement in dyspnea. Acute care hospitalization rounds that out, and that is based on claims measures, whereas all the others are based on OASIS. So which home health agencies will have star ratings for patient care? Well, home health agencies must have at least 20 complete quality episodes in order to have a star rating. And what's a complete episode? A complete episode is a paired start or resumption of care with an end of care OASIS assessment, which must have occurred within the 12-month reporting period, regardless of when the patient was admitted. Home health agencies must have reported data for at least 5 of the 9 measures in order to have an overall star rating for patient care. And home health agencies must be at least over 6 months old, and that makes sense given that an agency that is less than 6 months old will probably not have sufficient data to have a patient care star rating. CMS released a preview report for the patient care star rating in March of 2015, and within that report, there's the overall star rating for the agency, a description of how the star rating was calculated, and a scorecard showing the actual calculation of the home health agency star rating. These preview reports can be found in your CASPER folder. This is what the first page of the preview report looked like for the patient care star rating. You can see the name of the agency and the overall star rating. On the last page of the preview report for the patient care star rating, as an agency, you can see how the 9 measures were calculated and the overall star rating calculated from those individual star ratings. With Axxess, we've taken that star rating, simplified it further in order to make it more readable by providing a report that focuses on the key measures and simplifies the interface so that an agency can quickly determine what their star rating is and areas that they need to work on improving. CMS wanted to give us a general idea and so published a distribution using data from July of 2013 through June of 2014 to show the distribution of star ratings. Star ratings essentially can go in half-step increments, and so an agency or various agencies can have star ratings of whole numbers or 0.5. So for example, a star rating of 2.5 or 3 or 5 would be perfectly acceptable. And the distribution showed that most agencies had anywhere from 2.5 to 4 stars, and that's where most of the agencies clustered around. So the majority of agencies had anywhere from 2.5 to 4 stars. So in terms of what the next steps are, we've already talked about the fact that the preview report was initially published in March of 2015, and in July, the patient care star ratings will be publicly available on Home Health Compare. So what can you do as an agency? As an agency, you want to ensure that all your clinical staff understand how to document in the OASIS. If they've not received formal training, arranging for formal training to ensure that they understand, reviewing that documentation for accuracy and completeness is extremely important because, again, that is where the patient care star ratings are coming from. And so changes that are being made now will be reflected much later, but it doesn't keep you from beginning to monitor that documentation if you haven't already. Reviewing your data on Home Health Compare, becoming familiar with Home Health Compare, and understanding where those measures are coming from is extremely important in order to be able to make the necessary changes before the data makes over to Home Health Compare. We talked about the fact that the star ratings are based on the patient care star ratings and the patient survey star ratings, which is the second category. The patient survey star ratings are based on the same data as the home health CAHPS measures, which are already reported on Home Health Compare. The HH-CAHPS survey is a national standardized survey with roughly 32 to 34 items measuring the patient's experience with the recent care that they've received from a home health agency. The HH-CAHPS survey instrument received National Quality Forum endorsement in 2009 and was recently re-endorsed in 2015. The significance of that is that the instrument continues to remain a valid measure for looking at or measuring patients' experience with the services they've received from their home health agency. For Star ratings to appear for a home health agency, they must be eligible for public reporting on Home Health Compare, the website, by having at least 40 completed surveys over a year reporting period. And even if a home health agency does not have a sufficient number of completed surveys for calculating star ratings, their HH-CAHPS measures will still be publicly reported. They just won't have any stars beside them. A lesson that can be taken from that is, even if you do not meet the threshold of 60 unduplicated patients, it is still a good idea, if you want to receive star ratings, to begin the HH-CAHPS process, such that if you have at least 40 completed surveys, have received your MPI number, chances are, once your name shows up on Home Health Compare, you will at least have data that shows up for those measures. And we'll look at that in a short while. So, which measures are being used? Well, these 4 measures are being used for calculating a star rating: the care of patients, communication, and specific care issues. The composite measures are comprised of individual questions that are then rolled up into these composites or domains. And the global item, the overall rating of care provided by the home health agency, is a question that's asked, and so it's comprised of simply one question. An overall survey summary star rating will then be calculated. So, based on our understanding of it at this point, there will be 4 individual star ratings for each of the measures, and then a 5th summary star rating, which is supposed to summarize all 4 of the patient survey star ratings. To give you an idea of the questions that form the care of patients, there are a number of questions such as, how often did home health providers from this agency seem informed and up to date about all the care or treatment you as a patient got at home? In the last 2 months of care, how often did home health providers from this agency treat you with courtesy and respect? Moving on to communications between providers and patients. In the last 2 months of care, how often did home health providers from this agency keep you informed about when they would arrive at your home? And so on and so forth. And there are a number of such questions. For the specific care issues, there are a number of questions there as well, such as, in the last 2 months of care, did you and a home health provider from this agency talk about pain? Or did the providers from this agency talk with you about the purpose for taking your new or changed medications? So those are the types of questions that form the composites. When looking at the star ratings for the survey summary, CMS also released data for 2013 to 2014. And in the case of the star ratings for the patient survey, there is no half-step increment. They're all whole numbers, 1 to 5. So it would be 1 star through 5 stars. And the cluster of patient survey ratings were around 3 or 4 stars for the majority of home health agencies. So in looking at what the star rating will look like, we don't have any preview of that. However, if we look at the hospital star rating system, it gives us some idea of what the star rating will look like on the Home Health Compare website. So what are some things that you can do as an agency? Well, be aware that in October of 2015, check your HH-CAHPS portal if you're participating in HH-CAHPS, because a patient survey preview report will be available. The data from this for this report will be pulled from April 2014 through March 2015. However, the star rating preview report is only for the agency. It will not be released publicly. This provides an opportunity for the agency to review their data before the January publication date. Star ratings will be reported in January 2015, and that data will be pulled from July 2014 through June 2015. The significance of those dates is, you'll notice that the data becomes available on Home Health Compare and is updated quarterly, and the lag time ends up being about 6 to 9 months. So as an agency, if you're not participating in HH-CAHPS, now would be a good time to begin, because it'll take 6 to 9 months for your data to finally show up on Home Health Compare. If you are participating, ensure that you start reviewing your HH-CAHPS results from your vendors and utilizing a vendor that provides the best tools available to allow you to make the necessary adjustments in near real time. We've referenced the Home Health Compare website. For those who might not be familiar, it was created, that is, Home Health Compare was created by CMS in 2003, and on the website is information for Medicare certified home health agencies, such as their demographic data, the services they provide, a number of quality measures, and in 2012 the patient survey results were added, and so you can find patient survey results there as well. You can find Home Health Compare by typing in www.medicare.gov or gov/Home Health Compare, or you can select your favorite browser, use your favorite search engine, and type in Home Health Compare. When the site comes up, you'll see a location and an optional field to be able to put in the name of the home health agency. Typing in a zip code or a city and state is required to begin the search. Once the results are returned, you'll see a list of home health agencies with the services that they provide. Selecting any individual agency allows you to drill down and view more detailed demographic information about the agency and the services they provide. You'll also notice that there are 2 additional tabs, which are Quality of Patient Care and Patient Survey Results. In the Quality of Patient Care, there are a number of domains, and underneath those are comprised of a number of the measures, such as managing daily activities. When reviewing the measures under that, you'll notice that there's the name or description of the measure, the percentage for that home health agency, along with the state and the national average for comparison. And so most of the domains, or all the domains, have individual measures underneath them. And by scrolling down through the list, you'll be able to view those. The third tab is the patient survey results, which essentially is data from the HH-CAHPS survey, the composite scores, and the global scores. When first selecting the patient survey results tab, the results for the service period, or the period in time when the data was collected, will be displayed, along with the total number of completed surveys and the response rate. When scrolling down further, the 5 composite, or the 3 composites and 2 globals questions will be displayed, allowing you or anyone coming to the website to see the HH-CAHPS results along with the state and the national average. One other feature on the Home Health Compare website is the ability to compare up to 3 home health agencies side by side. From the selection page, 3 home health agencies can be selected, and when you click on Compare Now, those 3 agencies are compared side by side for both the quality and patient survey measures and the results from those. If there's data available, the percentage will display. Otherwise, not available will display where the data should be, along with a superscript with a description of the cause for why the data is not being displayed. Part of what we've done at Axxess is to go ahead and create a summary report for current CAHPS customers, allowing them to view not only the domains, but the questions that are comprised in those areas, and then whether the measure is going up or down, whether there's an increase or decrease overall, making it easy for a home health agency to quickly determine areas where they may need to focus on improving to improve their overall HH-CAHPS score. We also provide a quarterly summary report to help agencies track and trend and see how well they're doing over time and what their percentile rank is for compared to state and national. The leadership of some home health agencies wonder whether there is any return on investment from participating in HH-CAHPS or utilizing the patient satisfaction data. At Axxess, we'd like to submit that patient satisfaction provides a competitive advantage to a home health agency. Satisfied patients are going to refer your home health agency without any additional prompting on your part. Many anecdotal stories have been told about couples receiving services from two different home health agencies and both patients switching to the better of the two home health agencies when they see the level of service being provided by a home health agency that provides superior care. Referral sources and other stakeholders are also looking at patient satisfaction data on Home Health Compare to determine whether they'll continue to refer to you or feedback from their patients. All of these translate to increased revenue. And if you catch our other on-demand webinar on value-based reimbursement, you'll realize that star ratings are going to be critical and a major indicator of the quality of care being provided by home health agencies and therefore the reimbursement that they receive.
In summary, we know for a fact that CMS will introduce star ratings looking at the quality of patient care services that are provided by home health agencies and also receiving the feedback of patients through the CAHPS surveys. This data will be made publicly available, allowing stakeholders greater access to identifying agencies that are utilizing best practices and offering the highest level of care. And we know that these will factor into decisions around partnerships, whether we're looking at accountable care organizations or other models of delivering care, and referrals. As an agency, you will need to take steps to ensure that you're staying on top of star ratings and all the components for those, because not only will they position your organization for long-term growth, but ultimately they're part of reimbursing agencies or home health agencies for the quality of care that they're providing and ultimately bending the cost curve. I want to thank you again for spending time with us to learn about the 5-star rating system and better understanding how to position your organization for long-term success utilizing the best tools available.
Thank you for joining our webinar today. We know that your time is valuable and are happy you chose to spend it with Axxess. Axxess is proud to offer a variety of resources to supplement your training and keep you in the know of industry news and updates. You can register for additional training webinars through our software or sign up to attend a live seminar on Axxess.com. We also provide tutorials, online training manuals, frequently asked questions, and on-demand videos through Axxess.com. Our expert support representatives are from this industry and have been in some of your shoes. If you'd like to speak directly with one of our representatives, we are just a call or a click away. You may call us at 800-795-5900 or email us at support@axxess.com. Now that we've given you all the great tools to make you an expert, join the conversation and connect with us on Facebook, Twitter, Instagram, Google+, and LinkedIn. Here we will keep you in the know with industry news and Axxess happenings. Thank you for your time today and for choosing Axxess, your partner providing the knowledge that empowers you to grow your business.